Do you struggle with sounding natural in OET? These 10 medical collocations will make your English more fluent and professional. Want to impress your OET examiner with professional English? Today, I'll teach you 10 essential medical collocations that will instantly improve your OET speaking and writing. Collocations are words that naturally go together in English. Using them correctly makes you sound fluent. Make a diagnosis, not do a diagnosis. The doctor made a diagnosis of pneumonia. Administer medication, not give medication. The nurse administered the prescribed medication. Experience symptoms, not have symptoms. The patient experienced severe headaches and dizziness. Perform surgery, not do surgery. The surgeon performed a complex heart operation. Take a history, not get a history. The doctor took a complete medical history before prescribing treatment. Prescribe treatment, not give treatment. The physician prescribed antibiotics for the infection. Suffer from a condition, not have a condition. He suffers from chronic asthma. Develop complications, not get complications. The patient developed complications after surgery. Refer a patient, not send a patient. The GP referred the patient to a specialist. Seek medical advice, not ask for medical advice. Patients are advised to seek medical advice if symptoms persist. Using collocations correctly will make your OET writing and speaking more professional. Help you sound like a native English speaker. Boost your score by improving fluency and accuracy. Examiners love when candidates use natural expressions instead of direct translations. Bonus quick collocation challenge. Which sentence is correct? A. The doctor made a diagnosis. B. The doctor did a diagnosis. A. The nurse administered medication. B. The nurse gave medication. A. The patient developed complications. B. The patient got complications. Answers: A. Must share this video with your friends and colleagues to help them also. Don't forget to like this video and subscribe, because I am dropping another game-changing OET tip very soon. Still then, happy learning, stay connected, see you very soon with a new video.